When you suspect you might be pregnant, the most difficult part is often the waiting. While your mind is racing with questions, your body is usually providing no immediate physical feedback. During the first 2 weeks post-conception, there is a 0% incidence of typical pregnancy symptoms. Most people feel no different. Furthermore, sensitive home tests used 10 to 14 days after ovulation are highly unreliable. Before a missed period, accuracy remains low. Because early guessing lacks reliable biological data, trying to force an answer during these first 2 weeks tends to produce more anxiety than information. Everything changes with one specific biological event, the missed period. This milestone generally occurs between weeks 2 and 4. This is the trigger that shifts your situation from the ambiguity of guessing into a concrete, actionable medical protocol. Waiting for a missed period isn't a delay of action. It is the necessary prerequisite for getting a result you can actually trust. Once that period is late, the first mandatory step is to take a home pregnancy test. It is only after this milestone that the accuracy of over-the-counter tests reaches its peak. Following this, between weeks 4 and 6, the body enters a validation phase, where internal changes finally become noticeable signs. This dashboard highlights the primary signals: nausea, breast tenderness, profound fatigue, and an increased need to urinate. You may also experience secondary signs, like mood changes or mild cramping. It is also common to see light spotting, identified as implantation bleeding. While these physical symptoms and a positive test are strong indicators, they are only diagnostic tools. They are not the final medical answer. A positive at-home result marks the end of home management. It is the signal to transition immediately to professional healthcare. To definitively confirm the pregnancy, a doctor will use clinical methods, specifically blood tests or ultrasound imaging. Unlike basic home kits, which can be affected by timing or user error, clinical diagnostics provide medical certainty. Securing a doctor's confirmation is the step required to transition from simply knowing about a pregnancy to accessing your legal and medical healthcare options. The reason for speed is practical. Your medical options regarding a pregnancy are strictly time-bound. This timeline shows the window for a medication abortion using prescribed medicines. Depending on local guidelines, this is generally an option up to 12 weeks. Once that 12-week window closes, medical management becomes significantly more complex, requiring specialist care within a hospital. Moving quickly in these early weeks is the single most important factor in retaining access to the least invasive healthcare choices. This is a medical procedure that must be done under supervision. Never self-medicate or use medicines obtained without direct medical guidance. Follow the protocol. Use a missed period as your only trigger to take an accurate pregnancy test. From there, secure immediate doctor confirmation to begin a professional medical consultation as early as possible. First, missed period. Then, pregnancy test. Next, doctor confirmation and early consultation. Following this exact pathway is the only way to ensure safe, informed, and timely control over your health.